So it's official, we started. Good afternoon. Welcome to the International Center for Research on Women. My name is Kirsten Shirk, and I'm the Director for Global Communications here. And it is my great pleasure to moderate today's conversation. If you're like me and you've spent more than 5 minutes working in international development, and you know that at some point, the issue that you've been working on for years, you've been trying to solve, you find that it's tangled up in another issue that you're not trying to solve, but someone else is trying to solve. But you're not funded to do this. We're not funded to talk to one another, or maybe you didn't even know. What is it? Why do we sort of have these blanks between what we do? Family planning for me is my perfect example, because I worked on it for 20 years. You work on family planning. That is, you have a family planning clinic, maybe you do STD prevention. But people who plan not to have babies may later plan to have babies. So where does that leave you? Where does that leave the client? Where is the handoff? Where is the connection? How do we make sure there's a continuous path of care for the same person, and that we know whether or not we're passing off is working, our two programs are working? How are we leveraging our information? Or, as has happened in another case, you're funded to do family planning. There's a different organization that's also funded to do family planning down the street by the same funder, but you didn't know that. So you're not actually communicating about your indicators, what's working, what's not. Why do we until you trip on each other in a conference a little while later? That's just in the same sector. Think about WASH. Clinics need clean water. Think about infrastructure. How do you get supplies to and from? These are all places where we could be leveraging each other's interests. We could be leveraging each other's information and resources. But we were funded to do that. So we don't, or we didn't know. This is why we are here today. This is the whole point of this conversation. Our speakers are all working on programs that are deliberately trying to make these connections, leverage resources, even to share basic information. At ICRW, we are really pleased to be the lead partner in India with the 3D program for girls and women. 3D, document, thrive, deliver, is based on the premise that women and girls lead, all of us lead multi-dimensional lives with multiple needs that we need to address at the same time. You don't do health first and then you'll get to your education and then you'll get to your economic development. No, this all happens at once. So how do we share this information? And this is what our conversation here is going to really focus on. What's working? How are different partnership structures working? What are they? Where are there opportunities for other ones? Our first speaker today is Ellie Price, the coalition coordinator of Locus, a coalition of international development organizations dedicated to advancing solutions to global development challenges that are integrated, driven by local communities, which I think is going to be a particularly important theme here, and built on shared measures. Ellie oversees all programs and operations of the coalition in pursuit of the research agenda. She convenes international development funders, policymakers, and practitioners who are designing, monitoring, and evaluating integrated multi-sectoral programs. As the coalition coordinator, Ellie is fostering dialogue on Locus's priority research questions while ensuring that these conversations are relevant to local communities in the interaction of practitioners in the global south. Prior to Locus, Ellie was a program officer on the Crisis Response and Integrated Development Initiative at FHI 360, and she's currently co-chair of the Young Professionals Network for the Washington chapter of the Society for International Development. I'm going to introduce all the speakers so that we can go smoothly through, and then we'll have plenty of time for question afterwards. Following Ellie is a speaker who really hardly needs any introduction in this room, Geeta Gupta. Geeta is the founder and executive director of the 3D program that I mentioned earlier and senior fellow at the United Nations Foundation. I'm just going to skip to the part where she used to be the head of it. She was the president of ICRW for 14 years, and for lots of us was the way how we identify ICRW. She is also she was recently the deputy executive director, deputy director of UNICEF. Also a member of the WHO Independent Oversight and Advisory Committee for Health Emergencies, And in 2017, she was a visiting scholar at Stanford and served as co-chair of the Gender-Based Violence Task Force at the World Bank. She served on numerous boards, including the Global Partnership for Education, Gavi, the Partnership for Maternal, Newborn, and Child Health, and the MAC AIDS Fund. She has received numerous awards, including Harvard University's 2006 Ann Rowe Award. We'll also have a virtual presenter, my colleague Ravi Verma in India. He is, as you might know, it's a little bit late in the evening, and we decided rather than hope for the best with technology, he would do a pre-recorded presentation. So you'll see that there is one more speaker on the screen than there is in the room. Ravi is our Asia Regional Director. He has served for more than 3 decades. He has more than 3 decades experience in programmatic research and evaluation, particularly in the areas of family planning and reproductive health, gender mainstreaming, and HIV/AIDS in India and throughout Asia. His work is grounded in gender equality with a special emphasis on men and masculinities. And he is, I lost my place there, sorry. His combined background in research and designing programs allowed him to bring to ICRW critical aspects of examining the social norms that are deeply embedded in human behavior. Prior to joining ICRW in 2007, Ravi was with the Population Council. You'll see a theme here through organizations. It's going to be really fun. Where he collaborated with partners to design, implement, and evaluate innovative operations and research projects on gender and HIV. This is his second career, though. For more than 20 years, he was actually a professor in the Department of Population Policies and Programs at the International Institute for Population Studies in Mumbai. I feel like I can't go to India without someone saying, "Oh, you know Ravi. He was my methodologies professor. He's the best." I'm just gonna brag on him a little bit. And last but certainly not least, we are joined by Sanyukta Mathur from the Population Council. Sanyukta is a behavior and social scientist and a researcher with the Population Council's HIV and AIDS program. Her research focuses on examining how social norms, gender and empowerment, and social transitions influence reproductive health and HIV/AIDS outcomes in sub-Saharan Africa and South Asia, particularly among adolescents and young adults. She leads the POP Council's Dreams Implementation Science Research Portfolio, assessing the outreach approach and effectiveness of interventions aimed at reducing HIV risks for young women and their partners in sub-Saharan Africa, which is what we're going to talk about today. She also serves as a senior gender and youth technical advisor for breakthrough research, an innovative initiative focused on generating evidence and promoting its use, because it's not just enough to study it, we want to use it, promoting its use to strengthen social and behavior change programs for improved health and development. Prior to joining POP Council, Sanyukta was assistant professor at the Mailman School for Public Health, my alma mater. And prior to that, she was here at ICRW. So, Ellie, I'm just saying, this may be in your future. All right, I'm going to ask Ellie to go ahead and start us off and take questions after.
Do you want us to go?
Would you like to do it?
You know, or I would like to sit.
Then you
I
may.
think I'll do that.
You may. You're perfectly welcome to do that.
Well, thank you. And I'm really honored to be on this panel today with people who are not only highly accomplished, but by virtue of fighting for gender equality, have displayed the courage that it takes to push against powerful patriarchal paradigms in this world. You know what some of those paradigms are in the development space. It's this very top-down, fragmented, and project-driven approach to solving long-term and complex challenges. At times, the way we approach it is downright patronizing. When we're developing solutions here in Washington, D.C. for other communities elsewhere in the world, without letting them lead on what their priorities are, we're robbing them of the resources and the authority and the power to lead the global development agenda. Pushing back on any dominant, powerful paradigm takes a commitment to doing things differently. I was recently reading an interview with Helen Clark, former Prime Minister of New Zealand and UNDP administrator until last year. And she was citing a World Economic Forum forecast that says to reach gender parity in pay, and workforce participation, and senior leadership, it will take 217 years. and 99 years to reach parity in parliaments around the world. Let that sink in for a minute. 217 years. As Helen says, different stakeholders have very different roles to play in this fight for advancing girls' and women's equality. And at Locus, we see our role as advancing solutions that are integrated and locally led and shared with the development community. Locus was formed in 2014 around a shared vision for doing development differently. When the original NGOs came together, we said, what world do we envision? We want to see a world where communities in the global south have the authority, have the resources, and have the power to lead the development agenda. And of course, grassroots development is happening in many pockets and in many communities around the world today. You'll hear about some of that, and I can tell you, there are Locus members who are supporting that every single day. But in terms of the way the industry is structured, we're not there yet. We're very far from it. And sometimes us NGOs are getting in our own way. We've developed these very technically focused business models to deliver programs in usually just one area, largely because that's how the industry is funded. So we've got a lot of work to do. So when Locus was thinking about our identity and what contribution we want to make to this, we looked at the different funding silos. There's education here, there's nutrition money here, there's gender money here, as if that's somehow separate from the rest of life, and economic development. In reality, we know these things to be intertwined. But nobody knows that better than a woman who is facing the very common issue of time poverty, particularly in parts of the world where she's described a role that involves the caregiving, the cooking, the cleaning, and the breadwinning, and countless other demands on her time. So let's not forget who else is putting demands on her time. How about the 17 different NGO workers that came by her house in the last few months with 10 different household surveys for her to complete? So the barriers to gender parity and locally led development are numerous, and they're very complex. And when Locus first came together, we said, if there's one thing that we could change in this industry, it would be to break down those funding silos. But we recognize in order to do that, we would have to work in partnership across sectors and across disciplines to design and deliver more integrated programming. But it's not just about programming. We're interested in integrated development at multiple levels. On one level, there's this technical aspect. How do you design interventions from just bringing together distinct disciplines and their approaches to amplify impact in one area, or to understand how outcomes might be different when you combine interventions? And then on this other level, where we're trying to develop multi-stakeholder alliances for long-term systemic change. And where Locus sees its more primary contribution is more on this technical level. In 2015 and 2016, we had some of our researchers, our M&E practitioners, and our technical specialists from coalition members come together and develop this research agenda on priority questions in integrated development. These are the things that we think are most important to answer in order to understand how we design, how we measure, and how we evaluate the impact of integrated programs. And we're committed to this not just because it's important for us to advance our own knowledge, but because we think it's necessary to build this evidence base in order to be able to convince the donors, as intuitive as it might seem, that they need to invest in integrated multi-sector approaches. And we're by no means done answering these questions. This is a living document, and this is for academics and for researchers, for other practitioners, for you and for me to take up and to wrestle with. Because in doing so, we think we'll start to build that evidence base, understanding what works and what doesn't work in integrated development. And so this agenda still largely shapes the workshops and the programming that we do at Locus. And I'll share with you some of the things that Locus members have come together and learned that has worked for women and girls. One of them is co-location of services. Shout out to the Hunger Project. We have John Coonrod in the room who can answer any questions about this approach. But the Hunger Project's epicenter strategy, he's written about on the Locus blog in a couple different places. And essentially, it's a physical infrastructure that brings together community mobilizers who are responsible for leading people to achieve certain goals that the community has identified, right? And these are tied to the sustainable development goals, whatever's most important to that community. And at a certain point in its history, Hunger Project folded in one of its other women-led, women-run training and advocacy microcredit programs under the same roof so that women could get all of their services in one physical place, saving time. Another thing I really appreciate about the Epicenter strategy is its commitment to gender parity at every single level of the organization, committee, subcommittee level. It's truly something that we can all learn from. FXB International has a village model of development that, in somewhat similar fashion, co-locate services, but it's actually really a bit more like one of these multi-sector microfinance models, which is probably most famously piloted by BRAC with its ultra core graduation approach. And there's nuances and differences to the way that the organizations approach these programs, and they're different in different contexts, but essentially both offer financial assistance to participants while providing coaching, business support, enterprise development inputs so that people are gaining income as they're coming off of financial support. But on top of that, there's social wraparound services. So education, nutrition, health services, whatever's needed in a particular place. I'd love to share fantastic results with you from these programs, but the reason I chose them is because they've been replicated, tweaked, adapted in so many different parts of the world. So I'd encourage you to look at what our members have written about it and what they've learned, what they've had to discard, what they've kept. PACT has another microcredit model that's more focused on equity. And then I'd also encourage you to take a look at Conservation International and SNV's writings about how they've had to think about constantly analyzing changing power dynamics between men and women. As an intervention proceeds, as many of you know, sometimes that can change for both the better and the worse. We constantly have to be paying attention to that. And then you'll get to hear about convergent approaches with 3 programs for women and girls today. What I appreciate about Locus, one of the many things, is that our commitment to doing things differently fundamentally pushes back against dominant paradigms that tell us that we should be competing with siloed trenches of resources. Instead, we've chosen to come together, to share our resources, to share our design approaches, to share our monitoring and evaluation frameworks, and also to confront our failures. That's a big part of it, so that together we can advance our collective knowledge on what works for women and girls in integration in different contexts and scenarios. And we're still a long way from that vision of gender parity, especially operating in the current paradigm, project funded. We at least want to be doing that to the best of our ability. So it's important that we keep answering these questions. We keep coming to the table and sharing what we've learned. Because we know that we won't reach that vision until every last woman and girl on Earth is fully and economically and socially empowered. Push back against the broken models that aren't working for her, to replace them, displace them with new models of inclusive governance and resource planning. So this is not a story about INGOs applauding ourselves for figuring out how to do better, more impactful, integrated programming. It's important. We do want to build evidence around what works and what doesn't. But what this is really a story about is deliberate commitments to doing development differently. Because what's most important is that the most marginalized, many of whom are women and girls, have the authority, the power, and the resources to lead change in their own lives. And like Helen Clark said, it'll take every effort from the glass ceiling smashers to the grassroots organizers and everybody in between to get there. So at Locus, we invite you to join us in that. Join us in advancing our knowledge, what works and what doesn't. And I'm excited to hear today how these amazing women and men on the video dedicated their work to advancing just that. Thank you.
Oh, yeah, I need to click up, yeah. Thank you. So, good afternoon to all of you.
Before I proceed, I'm going to talk to you about the 3D program for girls and women that was founded almost exactly a year ago. My colleague Sia Navroji is the program director. Vanessa Coelho is our executive assistant, and recently joined the team is Kali Shetty, who is going to be helping us with some of the research. So this program, we are the core team here based in DC, and the core team in India is ICRW Asia Regional Office, and Ravi Verma, as you heard, takes the lead on that together with Sapna Kedia and Shweta Bankar. And Madhu Deshmukh, who once was ICRW, now an independent consultant, is also working very closely with us. Just to expand a little bit on which one?
Right, yes.
What you just heard Ellie say, which is what we are trying to demonstrate at this point in time in India and hopefully in other countries soon, is a convergent approach to empowering girls and women. And we're doing that. We have the 3Ds because we're doing that by using evidence on what works. So gathering the data and evidence that's necessary for the document, driving diverse stakeholders together so that they work together across their various interests, and doing that in order to develop plans and that are action-oriented to develop an essential package of services for girls and women. And we're focusing essentially on 4 components of what we consider to be an essential package, which is economic empowerment, reproductive health, secondary education with the transition to work, and safety with a focus on public spaces, because safety in public spaces is what affects mobility and often the access to the other services. So that's the deliver part. And that's how we came up with the 3D, though I have to tell you a little too cleverly, we also intended it for it to represent the fact that women are 3-dimensional, but really multidimensional. So what is convergent action? This is how we define it. We define it a little differently from integrated development, only because the integrated development I've seen requires everybody to work on one team and have one leader and come together with their different sort of skill sets. What we are saying is you actually don't have to jointly implement. You can do your implementation on your own, but what you do need to be guided by is a common plan, a common vision of how each of your pieces, of the different pieces, fit together to achieve a common end. So what we hope to do as 3D is to facilitate that joint planning, the monitoring, the accountability, by providing evidence, by providing whatever technical support is necessary. But another key component here is for any of this to work, you need it to happen at scale. And we figured that particularly India, but in almost every country, it's the government programs that achieve scale. So how do you get government to do this and then use the commitment, the innovation of civil society, the resources, the flexibility of the corporate sector, all of that to come together so that every stakeholder is bringing to the table what their relative advantage is in order to achieve a common goal. So that's sort of the vision behind convergent action. So there's no one model for convergence. I have to tell you that we came up with this word sitting in DC, landed in India and found everybody, I was about to define what I mean by convergent action, and they said, yeah, convergence, before I could say anything further. And they've actually tried it in different circumstances, in different ways. So there are many models of convergence that are out there in India, but we feel that for effective convergence, one, the point that Ellie made so eloquently, which is it has to respond to the needs of the women and the girls and the community. So it has to be demand-driven. It must leverage the relative sort of specialties and advantages of each stakeholder. It should avoid overloading any one group. The classic example in India is the ASHA worker who is told to do everything, right? To do the family planning, HIV, nutrition, and everything else. So avoid that. Have the right actors who can bring something to the table. Provide the incentives. This part is incredibly important to sustainability. So they have to feel that they have to be motivated to do this together. Otherwise, you're in trouble. So each one has to be able to derive a benefit for their own programmatic goals in order for it to happen. And then obviously for it all to happen in the same place at the right time so that you can see the results. we are trying two approaches in two different sites. So we've picked Pune, in Pune district in Maharashtra state in India, which is the same state that has Bombay in it or Mumbai in it, that most of you have heard of undoubtedly. And within that, we've decided to focus on both rural Pune and the district of Pune, the rural district of Pune. So, I mean, the urban city of Pune. And but in each place, we are taking a sort of slightly different approach. So in rural Pune, what we want to do is, and we are doing, is engaging the district government to create some kind of an institutional mechanism that brings the different departments of the rural government together, but also allows for CSO engagement as well as the private sector to bring its CSR expertise, money, etc., to bear for low-income girls and women. And in urban Pune, because I don't know if you've worked in urban centers, but you know the planning there is incredibly complicated. It's quite political. There are many different actors involved. So we decided it was perhaps too complex to resolve, but instead we decided to focus on a subpopulation of low-income women, and these are the most marginalized socially, Dalit women who are waste pickers in Pune city. They're informal workers, and they have already been organized by an NGO into a union, into a trade union called KKPKP. You have to have that roll off your tongue so you can't remember it. And they have also created a cooperative from the union that has an arrangement with the municipal sort of municipality to provide waste picking, garbage collection services to households in 50% of the city. So they actually go and collect garbage that's sorted, hopefully, by the householder into dry and wet waste, and then their income comes from fee that the household pays them, as well as from the recycling of the metal, paper, glass, plastic, etc., that they then sort and sell to wholesalers. So that's the way in which they have their livelihood. And what we decided to do was to try and take advantage of that arrangement that they have with the municipal corporation, as well as the union, the fact that they were already organized, but try and make that platform more sustainable. And so that their livelihoods could be more sustainable. And then also look at what the municipal corporation should be providing them by way of social welfare benefits and entitlements that they don't actually receive, is what we learned. So the collective, the Convergent Action in the urban center then is a little different because it's focused only on one subpopulation and trying to converge different services for them. Whereas on the rural, we are actually trying to have an impact on the entire rural district through the rural government being in the lead. In both of these, we want the government to be in the lead because without that in India, nothing will move. So that was a decision we made early. So this is just to share with you some statistics from the most recent NFHS on Pune that we could find. And you can see that even though Maharashtra is a pretty advanced state, it's a progressive state, and certainly Pune city and the district, that whole district, I would say, is very progressive, has a socialist sort of tradition. They were the ones who were the freedom fighters. They were the ones who created the social reform movement in India. And they're economically pretty well off as a city and as a district. And yet you can see that there's many indicators up on this slide that don't look so good. And in fact, some of them are worse than the national average that need to be attended to. The age of marriage is pretty startling. The fact that the education is so low that kids, girls who finish 10 years of education, that's a low percentage. And then if you look at the sterilization rate, that's much higher than the national average. National average typically at the moment is about 36%. And we came across a statistic, and I couldn't find it again, but if anybody does, let me know, that the average age of sterilization in Pune district is 24. So that's pretty startling, and we see that all the time. Girls get married young, and then they have 3 kids or 2 kids rapidly, and then they get sterilized. And as one woman said to us, so what's the problem with that? I got the children I wanted and I chose sterilization. The point is, does she really choose? Is she offered an option? Is that the only thing she knows of? It's also the age of first pregnancy then is very young. And because spacing methods, they don't use that much, it's just condom use essentially. What then are we trying to do is we are trying to facilitate convergence. So our role is really to try and convince the different actors that there's a value to convergent planning, that let's try it out together and see how it works. And so that requires leveraging a lot of the political capital that each of us individually has, that we have through our networks, to get people around the table. And I have to say, we've been incredibly impressed with how open the government is in Maharashtra, both at the state level and at the district level, to wanting to do things better. Overall, I would say in India, there is urgency. It's pretty high priority to do something about the status of girls and women. They know that they're lagging behind given where they are economically. So, to get the private sector, to get civil society, to get government to listen, to cooperate, to ask for what is it that we can bring to the table was kind of an easy in for us. In terms of the data and evidence, obviously ICAW is a big partner for us on this. They've just completed a landscape analysis for us of the entire district, and another consultant has put together what are the economic empowerment programs and schemes in the district that are offered by the government and which of those work, what is the evidence around how they work. And of course, we are sort of including women's perspectives from the ground up and looking at everything through a gender perspective, analyzing the data from that perspective. It's clear that we will need women's platforms, and there's several civil society organizations who have those platforms at the village level, who can provide us that feedback, maybe ultimately set up an accountability, citizen-led mechanism for what we put in place. And gender analysis, I have to tell you that even the government supports a research institution and a training institution that has gender analysis and capabilities, but doesn't necessarily use it in the planning. So it exists, and how do you connect that? So this is what we have done so far. We have a non-financial MOU with the rural government that allows us to actually create what we are calling the District Convergence Planning Committee, that will be chaired by the head of the district government, who's called the CEO, who is the sort of guy who's in charge of social development for the rural district. And they have agreed to have the heads of the various departments around the table, coming up with a common vision facilitated by the evidence that we will bring to the table, and then bring in the CSOs and the private sector, depending upon which issues they want to focus on, leveraging the schemes, the resources, everything that exists in the district. And then in terms of the urban area, we are in the process of creating, using a platform that exists in Pune, which is the Smart City platform, looking at that to see whether that could be the platform through which solid waste management for the city could occur in an inclusive way, with the Waste Pickers Union being represented. Already Smart City has corporate sector involved as well as civil society engagement. And could that become then for the whole city a solid waste management platform that could guarantee women a sustainable livelihood without having to depend on these individual agreements with the municipal corporation every 2 years. And then, of course, all of the analysis that I've already talked about, and the bringing in women's perspectives. We are in particular interested in creating something that the Population Council years ago got us all excited about, which was the quality of care framework that was developed for family planning, which we are now trying to look at that and other indices that exist for quality of services to see, can we create a quality of services index overall across the kinds of services, whether that's schooling or reproductive health or family planning or economic programs, and we're working on that as well. So these are the steps, essentially, if you were to pick an issue such as ending child marriage, let's say, if that's the one that they pick. This would be the steps that we go through with the DCPC, the District Convergence Planning Committee, which is which schemes that exist currently address this outcome. And there's always a scheme for everything, just to give you sort of an understanding of that. Pune has about how many CR? 300? 3,000? I forget how many. 300 schemes that are currently operating with budgets from the government. So you can imagine how much money they spend. And then which are the government departments? What value can the NGOs add? What value, what can the private sector bring to the table? What do girls and communities say they need? And then come up with what's the jointly agreed upon goal, outcome, targets over time, and then the components of a plan to achieve those outcomes that we can help them set up a monitoring framework for. And what the plan is to embed somebody with the monitoring expertise in the government for a period of time to build that capacity, but also link them to existing research institutions and this training institute I was talking about to get them the gender expertise. I can see Kristen's looking at her watch, so I'm going to go fast. So what we ultimately hope is we will be able to institutionalize convergence. This is the big dream, that the district convergent planning committee will become, become a part and parcel of what they call the DCP, which is the district, DPC, sorry, the district planning committee, which plans overall, to have a solid waste management platform for sustainable livelihoods, and to have plans that are actually tracked, that are validated by women, where government can be held accountable for what's put in place. These are our various partners, many in India, but ICRW obviously critical here, and Locus has been a very important partner for us, see ourselves on the Locus as a member, so that we can learn from other organizations as well as we all attempt to do integrated programs. So let me stop there and say I hope conversion becomes part of your lexicon and development, and that you look to India and that we can take convergent planning then to other countries. We're hoping to next pick a country in sub-Saharan Africa in the year 2020 and move there. So thank you.
You can see it's an incredibly exciting project with lots of pieces, and yet when you lay it out, it seems like we can totally do this. It's easy.
So as I said, our third speaker is our virtual speaker, Dr. Ravi Verma, in his office, from his office in India, so that we can make sure the technology works. So he will not be able to take questions, but hope he works well. Anyway. Okay.
See, convergence is not a new term in India. Within the Indian planning process and Indian policy think tank, there has always been a conversation around converging different programs. The idea has always been to synergize and to maximize the outputs of different programs because of the overlapping geographies and overlapping objectives of many of these programs. So in a nutshell, there has always been a conversation and a discourse around convergence, which is not really so popular or well known in countries other than India, especially in West. People don't use the term convergence, but among the Indian policymakers and program people, if you talk about convergence, they immediately get the idea that there is a need to bring together programs in terms of its resources, in terms of the joint planning, in terms of measuring the outcomes, in terms of monitoring its activities, and in terms of sustaining the activities in the longer term perspective. So, given that kind of a background, when we began working on the idea of convergent action in Pune district, we did not have much of a problem of setting up discussions around this. We could, it was not something out of the blue that we were talking about convergence. It was something which was already there. And there are many programs that are already doing convergence. For example, ICDS program, which is the Integrated Child Development Scheme, works under the Ministry of Women and Child Development, but works very closely with the Ministry of Health programs on the ground with the child survival and maternal health program. So there has always been some kind of a convergence on the ground, bringing together these two different streams of work which are monitored vertically by different program people. So the idea was that how do we bring that kind of an experience with a larger perspective of enhancing gender equality, going beyond the sectoral outputs or outcomes. So we don't stop only by measuring how many children survive, but we wanted to make sure that all the survivals or all the good health outcomes have also enabled women and girls to enhance their own ability in terms of making choices. So if the health is improved, if the education is improved, the idea is that the girl and women should then use that betterment on some parameters of their life to enhance their own sense of agency. They should get the voices, they should aspire, and they should feel safe and do things that they want to do, like anybody else does, like men do or boys do. So that is the idea. So the journey became a little difficult when you begin to take the higher level outcomes into the convergent programming, because that is not so easy to come by. Most outcomes in these sectoral programs are measurable in very tangible terms, but the kind of outcomes we have in mind in the 3D, they are of the type that impact the norms, that impact the work culture. In fact, that they address the issues of breaking their own boundaries to come together with a common objective without being competitive about their programs. And that's difficult because work culture is competitive. The programs are siloed because of the resources, and high level objectives of girls' agencies or the gender equality, they are not so tangible to measure. They take time, and programs don't wait for that long to achieve gender equality as their performance measure. So as a result, there were inherent contradictions in the convergent program objectives and the way programs are structured on the ground. And that's the biggest challenge. So how do we do it? What we think, and this is what the experience that we have generated from many other projects that we work, and not only 3D, but in 3D we wanted to bring that experience, was to ensure that there is a high level of commitment to this issue. One cannot do the convergent action only at the downstream end of the program implementation. The convergence have to be part of the overall ethos of the program. There has to be a common vision at the top, and therefore all the sectoral heads and the top level bureaucrats, officials, program managers need to agree with the common vision of achieving gender equality, and then deconstruct that vision into their own sectoral programs by looking at the specific indicators and specific ways to achieving them without contradicting but complementing each other. So that means a high level commitment, and that's what we have tried to do in 3D program in Pune. So we had series of conversations and a series of advocacy meetings by bringing together different sectoral managers, different stakeholders, corporate sectors, the private and the civil society, to openly talk about issues of meeting the agenda on the issues of gender equality and girls' empowerment and women's empowerment. So once having done that, having achieved that, that is the higher level commitment, we are now in the process of ensuring that this gets operationalized in the program, in different sectoral programs functioning, the manner in which they allocate resources and the manner in which they achieve their own, they tend to monitor their own progress. And that's the second level of challenge that we are now engaged with at the program implementation level. So that is how do we do it, and it is unfolding, and we will learn as we go along. We are not sure whether this is the way to move forward. That's top down. We think there could be many different ways of doing convergence, and there would be different opportunities for doing convergence, and that's what we would learn as we go along in this project. Having said this, the opportunity that we see as a tremendous opportunity to do this is by way of bringing the women's groups of civil society into the central stage of Convergence program, so that they can hold the system accountable to do what they promised to. And that's where our work in the rural Pune is about meeting with the women's groups and ensuring that they are on board in this conversation, so that they can also set the agenda of Convergent Action together with the government programs and the corporate houses, and they would, and therefore they would be equal partners in not only holding the mirrors to the government, but also making sure that the Convergent Action is done as per the common vision of everyone. And I think, given a very strong civil society movement, very strong grassroots movement in Maharashtra, and very strong women's groups, there's an opportunity that we can connect the supply side convergence to the demand side or people side of convergent action, impacting the norms and impacting people's behaviors and practices on the ground.
Thank you, Raj. So now we're going to listen to a bit more about how Pop Council is approaching this through the Dream Project. And the footnotes right there are for you to take.
Great, good afternoon, and I'm so pleased to be part of this panel. And I'm going to talk about Pop Council's involvement in the DREAMS implementation science research. DREAMS, I think everybody in this crowd will be familiar with it, and I noticed my OGAC and PAR colleagues are here, so maybe they'll stick around to answer more questions about some of the programming. But I can give you a very quick overview, I think. Actually,
Point right, so point to that picture. See that first.
I'll try it. Somebody can move. I don't know. I'll keep talking. Maybe we can move.
There we go.
Great. So let me give you a very brief overview of DREAMS. DREAMS is a public-private partnership. It was initiated by PEPFAR in 2014 on World AIDS Day. It also includes the Bill and Melinda Gates Foundation, Girl Effect, Johnson & Johnson, Gilead Sciences, and ViiV Healthcare. And it is an integrated program that is aiming to help girls develop into determined, resilient, empowered, AIDS-free, mentored, and safe women. And that's what DREAMS, the acronym, stands for. It has a very ambitious goal to reduce HIV infections among adolescent girls and young women aged 10 to 24 in 10 sub-Saharan African countries. I've been working on adolescent health and development issues for a long time, and one of the reasons I was really excited to join the council and work on this project is because the program has very unique elements. It is providing a package of services for adolescent girls and young women to address not just health sector issues, but looking beyond that to address social and structural determinants of their risk specific to HIV/AIDS. And it is really explicit about some of the gender dimensions of risk in the programming. There's also layering for multiple interventions, so it's working with girls, but they're also working with parents and partners and community in general in these high-risk subnational settings, settings where HIV prevalence rates have been particularly high and not enough intervention has gone in. Interestingly, a lot of the DREAMS interventions are also trying HIV prevention interventions that have existed, but now being done at scale for adolescent girls and young women. And some of these include focusing on building the social assets of adolescent girls, looking at cash transfers for girls, and in some countries where it's available, introducing pre-exposure prophylaxis. It also includes the inclusion in very young persons. So when we talk about adolescent programming, often it's 15 to 24-year-olds. DREAMS in many countries includes working with 10 to 14-year-olds. And it targets most vulnerable girls, and the idea here is trying to reach the girls who are most susceptible to HIV and AIDS. So council's role in DREAMS is actually twofold. I'll be talking mostly about our evidence generation portfolio. We are the global implementation science partner for the Dreams Initiative. My colleague Miriam Temin, based in our New York office, leads our capacity strengthening portfolio. And we are working directly with implementing partners in select countries and thinking about intentional design for adolescent girls and young women. Our work is funded by the Bill and Melinda Gates Foundation, Project SOAR through USAID, and Girl Effect. So let me speak a little bit more about our implementation science research portfolio. We are focusing on 3 cross-cutting themes, and as I laid out some of the innovations, we went through a fairly extensive process with PEPFAR teams in country and the implementing partners, as well as various donors, to think about what are the real research questions that need to be answered. And we focused on these 3. The first one is really looking at assessing the effectiveness of community-based girl-centered programming. How are programs identifying and reaching the most at-risk girls? How is the program really implemented on the ground? What is the effect of engagement in this program? What are the costs? What are the challenges? Some of the very questions about integrated programming that you just started raising, Ellie. The second key element that we're focusing on is really around male partners of adolescent girls and young women. Because that is a component of Dreams programming, we are speaking directly with men and male partners of adolescent girls and young women to understand their characteristics, how they define relationship risk and dynamics, how to get men into services. If you've worked in HIV, you know men are often out of HIV services, so this is part of our work. And third, I think a new and emerging field is really thinking about the feasibility of introducing oral pre-exposure prophylaxis to the HIV prevention package for adolescent girls and young women. Next slide, please. So we're doing this work. Dreams is in 10 sub-Saharan African countries. We have 10 research activities across 7 Dreams countries. And there was a very extensive process of working with each country team to figure out which are the key research questions that they're interested in answering. Our research approach, very broadly, I have materials and can speak to people after the event if they're interested in more specific research design. But we've intentionally designed the work to be in multiple phases so that we are feeding into the program implementation and refinement as the work is happening. We are about 1.5 years into the research project. We are purposefully employing mixed methods research in all of our studies, so that includes quantitative work, either cross-sectional or cohort surveys, doing qualitative work as well as a lot of participatory methods. Importantly, we are focusing on capturing the perspectives not just of the beneficiaries, but also of the implementers. We do a lot, and some of the implementers are part of the Locus initiative, so we've spoken with several colleagues about their experiences in developing and implementing these types of programs. And a key aspect of our work has been engaging stakeholders early and often throughout the process. And this is really in-country stakeholders, whether they are community leaders, whether we're talking about the implementing partners or the local missions, to keep them informed about our research process. In the brief time that I have, let me just give you very high-level sort of takeaways from our implementation science work. The first thing that I think we were struck by, and I think we confirm, is the immense need for this type of multi-sectoral emphasis on adolescent girls and young women. We find that the Dreams program sites have very high concentrations of HIV risk, and this is confirmed in our survey work in Kenya, Malawi, and Zambia. So for instance, half of the girls in Kenya have lost at least one parent. We have a third of girls in Malawi have report current STI symptoms. We have 20% of girls in Kenya and Zambia who have reported either physical or sexual violence just in the last year. These are self-reports, so you can only imagine we're catching the tip of the iceberg. We confirm that this vulnerability, therefore, is multifaceted. So the Dreams program and what it's trying to do, I think, is the approach makes good sense. And through great effort, the programs are working very hard at trying to recruit the most vulnerable, the girls who are most susceptible to HIV risk. And so they are reaching the girls who have multiple partnerships. They are reaching the girls who are from orphan households. there are still some certain subpopulations of adolescent girls and young women that are not as well represented, at least early in the program. The out-of-school girls, the married girls, and so we've been working with the programs and thinking about how can we redouble our efforts to reach those groups. We've also been, as I mentioned, speaking directly with male partners of adolescent girls and young women, and one thing that we sadly confirmed is the very high HIV risk profiles of male partners. And what I mean by that is lots of multiple concurrent partnerships in age disparate relationships and poor access or disparate access to HIV services. So testing, but not always the right time, limited condom use, delayed entry into services. And so I think as the programs evolve, we really need to think about how do we meaningfully engage partners of adolescent girls and young women into services. And from our PrEP portfolio, one thing that we were really interested in a lot of countries as they consider this new HIV prevention package is how feasible is this for young women? And we were surprised to find very strong support for PrEP from parents, from healthcare providers, from policymakers, from partners in country. They all clearly recognize that PrEP could add a lot to the prevention package for young women, but that the introduction really needed to be destigmatized. So what is the right way of providing it? What is the kind of messages that we do around it? I also wanted to share a little bit of the insight on some of the girl-centered programming, and these come both from the capacity strengthening work my colleague Miriam Temin is leading, as well as some of the implementation science work that we have been doing. One of the things we learned very early on is that programs really needed refined tools and approaches to identify and reach the most susceptible adolescent girls and young women. Resources are limited. The programs are focusing on trying to get the girls that most need to be in program. Many of you may be familiar with our girl roster toolkit that is being used by many of the implementing partners and DREAMS to identify the most at-risk girls. The programs needed to work, and especially at the beginning stages, very critical to gain buy-in from parents and guardians, and particularly male partners of adolescent girls and young women. And we've heard this over and over, and we can see it also because married girls are facing greater barriers in being able to participate in this program. So the implementing partner here talks about, some folks were ready to be assisted, but really their husbands were not ready, and men fear their wives and their partners being involved in a program that they don't have access to. So their partners have been working on breaking down some of these barriers. And the other point that we have been talking about, and I think connects very closely to some of the convergence points that have been raised already, is this importance of developing coordination and cooperation amongst the implementing partners. There are different models being applied in each country because the program is sort of country driven. So in places where multiple implementing partners are coming together to work in a specific geographic area and provide a package of services, how does one come together and create those sort of common goals, understanding on how to create effective referral systems, how to create effective coordination of the programming. As I mentioned earlier, we are at 1.5 years into the project, so we're going to have a lot more soon on our findings about the effectiveness of the program and the strategies. I did want to leave you with some of the quotes, because what we are hearing from the girls and from the implementing partners is the tremendous effect that they see already of this program in their lives. So girls talking about having access to greater information, being able to say no or move away from risk behaviors, also confirmed by an implementing partner. These are quotes from Zambia. And my personal favorite story was a father in Kenya whose daughter was abroad in Uganda, whom he called back so she could participate in the DREAMS program. So I think once that sort of buy-in and community engagement is built, people were quite excited about having this opportunity for young girls. So next slide, please. And so I just wanted to tell you to stay tuned. We have lots more coming. In fact, we have a webinar next Tuesday to talk about some of our work with male partners of adolescent girls and young women. We're planning a DREAMS learning event with Center for Global Development on June 1st. Many of the research, much of the research from the implementation science, as well as the impact evaluation portfolio that is being led by the London School of Hygiene and Tropical Medicine. There's a +1 special collection coming out, and we will be sharing a lot more of our results in the coming months. Thank you.
All of our speakers, it's just been perfect, and I feel incredibly inspired and optimistic about the work we're doing our work more efficiently, and more effectively. So we're going to open up the floor. I'm actually going to take the first question, take the moderator's privilege, and then we'll open up to the floor and online. So, having said how optimistic I'm feeling, what do you feel? And you particularly because I know a little bit more about 3D. What are when you said that you're driving partners to work together? What do you see the barriers? What do they express are the barriers to sort of this collaboration?
It's basically what Ravi talked about. It's the organizational and systems culture that you're trying to work with, and it's a political economy where if you don't know what the levers are to shift the motivations or what they perceive to be rewards for good work. It's going to be difficult to bring them together. So there is a political economy analysis that we're not doing in a formal way that's constantly in the back of our minds about who reports to who and who gets motivated by who says what and whose blessing do we need and who do we need and how often do we need to mention that in order for some people to come to the table, etc. They seem like minor things, but we're trying to document that.
I was going to ask, are you documenting
Yeah,
this? It feels like
that as we go along, because I think it's part of the methodology, in fact, is to try to figure that out. And I don't think it will be that different from one Indian, rural district to another. It's probably the same set of things that operate.
And maybe not just
right. And the biggest block, the biggest challenge we're dealing with right now is the transfers. You really get to know somebody, you figure out what drives this person who's in a position to bring about certain changes, and that person gets transferred to some other job. And then you start all over again. So, so far we've been lucky because the transfers are fairly, what should I call them? Incestuous almost, because the municipal commissioner becomes the head of smart city in the central level, but we're working in smart city, so that's fine. And the district collector is now probably going to become the municipal commissioner. That's great because the district collector was on our side. So far it's just musical chairs rather than totally new characters. But we'll see as we go along. That's one of the challenges we had foreseen actually as being a problem.
Oh my gosh. I'm going to start with the back. Okay. Go ahead, tell us your name and ask what.
Yeah, so my name is Eloho Basikoro. Thanks so much for the presentation. So I actually did research on looking at the challenges, both at individual level and institutional level against HIV treatments amongst, HIV positive in Nigeria. And some of the challenges that I saw on the feed is also the same thing that, all of you mentioned. But even what was most critical was this lack of multi-sectoral, approach at the level of the government. I know Ravi mentioned something about, if the policy stakeholders at the top can actually agree, we're going to have like this kind of disintegrated model of intervention. But the thing is, what I observe is we have this institutional politics around gender. So with male policy stakeholders always pushing back against the idea of gender mainstreaming. So he said something about, having an approach that brings, these stakeholders together so they can agree on a particular ideology on gender. But what wasn't really clear is how do you do this? So I don't know if is it Gita or Jita? Gita. Okay, Gita can address this, please.
You want to take only one?
Yeah, I was going to say, we take John for it.
Oh, thanks. All right, I'm going to pile another one on Gita. So Maharashtra is really interesting because in their bottom-up structure, the Gram Sabha, we used to have mandatory Manila Sabhas before the Gram Sabha, local assembly. And I'm just wondering how that and the blocks fit into this strategy of convergence, because ultimately of the villages where everything has to converge.
I'll take one more. There.
Yeah, so, sorry, this may also be a little directed at Geeta, but I'll try. It applies to actually all of your work. So I'm wondering a little bit about more on the demand side. How are you identifying these NGO partners and more importantly, women's sort of organizations? Because like Pune, for example, is fairly large and I've worked with sex worker collectives and they're very isolated from other women's organizations, both in the rural and the urban area actually. So do these marginalized women then become even more marginalized when they're left out of all these programmings that are speaking to the demands for other high-need women? Similarly, say with the NGO sector, when you're working or when Locus is sort of focusing on multiple NGOs, my experience with Rwanda, and it may not be the same with the countries you're working in, is that once you form this sort of network of partners, then information gets controlled by just those networks, money just comes into them. Other NGOs doing good work who didn't hear about it or didn't get to become partners get left out. And again, you're creating this sort of complicated demand space and speaking to the needs of those particular voices. So how are you selecting these organizations that you're putting together and mapping it out? Because it's really hard. I've been in Rwanda for over a year and a half, and I still don't know all the players in a small refugee camp with 3,000 people. So at country level, it's almost, impossible.
Let's start with
Okay, so I'll get us started. How do we get those leaders at the top to sort of even talk to each other, right? So what we did, the mechanism we used is workshops, and we did workshops on particular themes. But we invited to the workshop senior government officials, but not just government officials. We invited women leaders from the Gram Sabha leaders, Mahila Sabha leaders, from the village, as well as like the union leaders and so on, as well as private sector representatives and others, to discuss one topic. Let's say women's economic empowerment. These are the schemes and programs in Pune. We'd like to hear what, from your perspective, works, doesn't work, what you can do better. It achieved two things in my mind. One, it wasn't confrontational. It wasn't that you failed, it hasn't worked. It was none of that language. It was, here's an opportunity, here's what we see are challenges, here's what we know works, what do you all think? Second, if there was any challenging, it was done between actors locally, not by us, right? And even those actors, what was interesting to me is because they wanted to work, were not challenging it in a way that was, useless. I mean, threatening. Yeah, it was more, let's problem solve together. The other thing was that some of the senior government officials who were there didn't say much. They just listened, and that was very telling to us. So the guy who's in charge of solid waste management for Pune was there for a half day of that workshop. And he just listened, and the woman who was talking the most was the union leader for the waste pickers. And I think that those things help. We then did a data meeting, which is, they don't share data. There's very little denominator data, beneficiary data, that they can say proportion of women did this or that, because they don't even know how many women were of that, was sort of suitable for that plan or scheme. But when we did that data, they were mostly all from the Census Bureau, from the Planning Commission, from the Niti Aayog, etc. And there, the conversation was very open, and it was fascinating to hear each of them discussing in a fairly open way, 20 people in the room, the challenges that they face in sharing data, that they don't have the same platform, the money that's been spent, the attempts that have been. So I think there's something to how you bring them together that makes a difference. I don't know if Sia wants to add more in terms of.
I think our approach all along has been, we have these three stakeholders, that's government, private sector, civil society, and what we have tried to do is create opportunities where we highlight the achievements to date, the opportunities, but also try and create an environment where that is open enough to talk about what could everyone be doing better and what do people need to do better.
I have to say it helps that I speak Marathi and I'm from Maharashtra. Because the minute you're a daughter of the land, then it's a whole other conversation. So that does help, which will determine the selection of our next country. Yes, to see us from Kenya, so how's that? Just to answer your question about, yes, we very much want that grassroots engagement, and in fact, all of our initial visits were through a particular NGO, MASU, to visit those organizations, to visit self-help groups, to hear from women how they were experiencing these services and what was standing in their way, what they can do, cannot do, seeing programs in action. So we did a lot of field visits and visited a lot of the women who are represented in panchayats. Now, in some of the more empowered groups, what we realized, Mahila Sabha still exists. So these are the women's councils that were created by the government to allow women to discuss their agenda separate from the village council, and then go into the village council prepared to make their case. What was interesting is that so many women in those areas where NGOs have been effective and feel so empowered now with their agenda, they think it's a waste of time. Why should we meet separately as women first? We go straight into the council because we know exactly what we want. And they have organized to fill the gaps where the government doesn't provide certain kinds of services or certain kinds of collective action has come out from the grassroots. So we're taking that into account, and a lot of the data collection happens by them, by the grants of us. So they will get involved in our process of accountability, for example. It's impossible in a place like Pune, as you said, to know every single NGO and to involve everybody. So we are being a little bit opportunistic, I'll admit that, right? So we're picking the ones who have had the largest reach, maybe more mainstream, who have worked more closely with the government, or been in opposition to them in very direct and open ways, so that we get a sense of the lay of the land, rather than trying to identify every single NGO. And we will begin with them. Remember, what we do with them depends on what the government decides are the 3 indicators they want to shift. They want to shift child marriage, they want to shift rate, enrollment in secondary education or completion in secondary education. So we're going to pick whichever ones, and then which NGOs get involved will depend on that. That's how we want to move forward.
Do you want to speak a little bit to that in Africa?
Yeah, I mean, Nora, please fill in if I'm just being editor. And the way that the program was done is in each country, PEPFAR initially, because they wanted to hit the ground running, they had a very ambitious target to reduce HIV infections. They started, the design was to work with partners that were already on the ground. They also then implemented a innovation challenge that sort of tried to reach different types of partners to infuse some innovation into it. One of the things that the council has been working on is that working with a select number of partners to really do intentional design for adolescent girls and young women. So just because you're working in this area does not necessarily mean that you are already focusing on adolescent girls, or if you're working with young women where you really work on HIV issues. And so part of the work that we've been doing is bringing some of that decades of experience that council has done on work with adolescent girls and fusing that with a select number of partners and countries. So there are different ways, I think, that we're trying to harness the range of partners. And I mentioned very briefly, there are different models of implementation in each country. Some of those are just how HIV program has been done. For instance, Kenya is divided into geographic regions, and a entity takes over all of the HIV programming in that region. So by definition, they're integrated in a different way than in a country like Zambia or Malawi, where multiple partners are working either by geographic region or by sector. So it depends on where you are and how those partners then need to be sort of harnessed and what kind of capacities.
I want to see if there's, I can over with you, are there any questions from the chat room? There are lots. Okay.
Yeah. I'll start and combine a couple of them. So from Michael, and thanks to all of you online. Appreciate your involvement in today's session. This is for Ellie. What are the intersections that you see between economic empowerment and gender-based violence? And then how has the project created ownership and sustainability?
Well, a couple of the stories that I mentioned in the presentation, SMB and Conservation International write about how when you're implementing any program, whether it's specifically or explicitly gender focused or not, and it's meant to empower women with more say in the household decision making, more money, that changes things. And now men are suddenly dealing with something that is maybe countercultural to what they expect. So it can often create unexpected dynamics where you're looking only at, are women making more money? Are women empowered? Are they having increased decision making in the household? You might be missing a half where other aspects of their life are getting trickier because they're now having to negotiate things that they didn't have to negotiate before.
We found some more things in work and research in Nepal. It wasn't actually what we were looking for, but it was surprising to see gender-based violence increase with increased economic agency and which led to, agency within the household. And it was sort of the backlash. And it makes you realize that this is yet another example of why convergent or integrated programming, whichever model, is so important, because you also need to be examining masculinity, working on men and male partners, engaging men in the larger process. So, yeah. Joe?
Sure. So this is for, let me read it. My experience on bringing young men into girl-centered interventions is that you have to be deliberate and keen to ensure you are creating safe spaces and opportunities for girls to excel and not risk exclusion of the same girls you are working to empower. How does DREAM work around this?
So a cool part of the DREAMS programming is the creation of safe spaces for girls in the community. And it's part of under the social assets umbrellas. There is a specific girl group structure that is generally by age and sometimes marital status, depending on the country context. And the aim is to provide interventions for those specific groups. In our implementation science research work, we're looking at how these safe spaces are working, what is the connection with the mentor in the community, what is the level of exposure to the different programs within those safe spaces. So that's a key part of what the DREAMS programming does.
I'm going to take you and you over here, and I have someone over here. So the last 3 questions, we have very concise questions and very concise answers, because I'm mindful of the time. So go ahead.
To kind of continue with what you were just saying, so you said that one of the biggest, in your presentation, you said one of the biggest factors as far as, or what one of the factors as far as kind of whether or not the program's work is whether or not the men in the household or in the area are on board, and then also as far as creating safe spaces. So I just wanted to ask kind of what messaging or what type of delivery kind of do you see that usually more so works to get men to kind of first buy in, and then once they are buying in, to kind of continue to make the space safe and not be more of a deterrent than a progressive type of thing.
Hi, my name is Sarunia, and I work in capacity development at PACT. I think this young man just stole my question.
You can just share it.
So my question is also related to, in particular, dreams. What current models are you guys using to foster the male buy-in? How are you addressing masculinity, toxic masculinities, and I suppose strategically addressing things such as gender essentialism? Because something like gender-based violence that happens when there is increased economic empowerment of women, to me, it's a tit for tat kind of situation.
Yeah.
But it's kind of like, how do you bring that man in? Is it through you're somebody's brother, somebody's father, somebody's husband? Or is it kind of like, is it a morale thing that, as a good person, you should do this? What ways are you looking to, I suppose, co-opt men into the idea that because this girl next to me is doing better, that doesn't mean that I'm doing worse? So how do you, I suppose, address the zero-sum game issue?
One last question from this side. Okay. Or you just go with this? Okay, go ahead.
Oh, okay. So I had a comment and a question, so I'll be really quick. Julie Pullerwitz from the Population Council. Thank you again. Just wanted to say that the whole idea of engaging the key stakeholders that Sangeeta mentioned earlier really resonated for me when you were talking about that. And that we at the council are also trying to be much more systematic in our process of bringing the right people earlier on, decision makers, members of the community, so that we go through these various steps so that at the end, whether it be research results or programmatic results, are more likely to be incorporated in program and policy. So I think that there are a number of us who are trying to move in that direction, and there are lessons being learned about how best to bring in the right stakeholders early on and have a mapping of who are those key stakeholders. And while we all have kind of technical advisory boards, are they really the right members to be able to take it forward later on? So just food for thought. The question I had actually for Geeta was around the gender-based violence component of the work that you're planning to do. And I noted that you were intentionally looking at violence in a public setting and wanted to know how that was going to play out as far as you saw it, and sort of what was your thinking about why you went in that direction, and as opposed to also tackling some of the partner dynamics that are also coming up here.
All right. Hold it there.
So,
Look through it.
yeah, I was start talking about dreams, but I'm gonna on Nora here, who's from PEPFAR, to maybe add in. Again, because I come from I'm the research partner, and I represent what we've learned from the implementing partners on some of what other strategies. I think when it's working really well is when partners have brought in key community leaders and parents and partners early into the process, and getting their buy-in about what the program is about, what are young women in the program going to be learning, what are going to be the kind of services that are being provided. And so to try and break down the barriers. I think part of what creates the tension is when there isn't transparency. So what we have seen the implementing partners doing is that kind of sort of systematic process. And the program itself includes a parenting component. So there are parents of adolescent girls and young women who are receiving part of the information and knowledge and services of Dreams. So I think that goes a long way in creating that openness and transparency.
Sure, so I can just jump in and talk a little bit about very little bit about the question that you had about the boys. So Dreams is about reducing HIV vulnerability in girls. And the reason for that is because if you actually look at the data, girls are up to 14 times more at risk than boys at the same age of contracting HIV. So Dreams we intentionally pushed out as pretty singularly focused on girls. Now, that doesn't mean that boys aren't also involved in a number of the interventions. So HIV and violence prevention in school addresses both boys and girls, parenting and caregiving, and also the community mobilization and norms change activities that we do in the community are aimed even more, I think, sometimes at men than at women. So, but at both. So that's why Dreams is the way that it is. That's why it's really focused very solely on girls who have really missed the boat on HIV. Because if you look at the data now, they have not been receiving the services they need to stay HIV free.
So my question is a little bit more centered on the idea, because if they're having sex, looking at a country like Swaziland that's predominantly heterosexual, they're having sex with men. So it's like in these situations where women are having sex with the old guy who buys them KFC when they're walking home from school, the young girl, etc. It's like when these interventions aren't as successful because, my sister can't do this, or my wife can't go here, my daughter can't go there, etc. Not necessarily looking at the Dreams program as something that is doing the same programs with men, but it's like, how do we engage men? Because 50% of the thing that we're dealing with involves the male perspective.
I think part of it, from the implementation science perspective, is understanding what the male perspective is and understanding what are the relationship dynamics of the age disparate relationships and what are the potential ways to intervene there. Right? It's not the blaming of men. There's motivations for these types of the age disparate partnerships and the dynamics and the risks within those relationships. Not all relationships are equally risky. And so from our perspective, and we're doing this work in Swaziland, interesting that you mentioned that, to try and understand who are the men and what is it that they need, and what are they getting out of the relationships, and then what do they need out of the services. So because Dream programming and PEPFAR programming is supposed to be this complementary set of activities, there's a focus on at least getting men into services. So part of the questions we can answer and maybe try and fulfill through Dreams. But there are other initiatives that are happening also around it to try and get at some of them.
Tune into our webinar on
I know.
And then
Yeah, just to answer your question, so it's in no way, but focus on public safety is in no way undermining the importance and effect that partner violence has and domestic violence has on women and girls. But we were trying to narrow our focus to issues that that government is responsible for, public safety, and that prevent girls from just being able to get to school, from getting services. But that turned out to be a barrier they talked about a lot. If you can believe it, of all the reasons that the girls that we talked to that were possible impediments to going to secondary school, the biggest one was the bus doesn't come at the time when I'm supposed to get from a rural area to the secondary school. And when I get onto it, I get harassed in so many different ways that I don't want to get onto it. So to think that that is an impediment to going to secondary school for girls whose parents are allowing them to go, want them to go the distance, right? So it struck us as being an area that is in the news a lot in India, but people are not thinking enough about. There's such a focus on inter-partner violence and domestic violence that we thought that we should focus on that. So that's, and just to, as a side note, just to say, the police are very difficult in terms of figuring out how they can help. They're very overwhelmed with all of the law and order issues that they have to work on. And they do things on the margins of public safety. So we try to work with the transportation department, trying to work with very creative, innovative NGOs who are mapping hotspots that are unsafe in a city, and trying to then get public attention to it or get EMT services, ambulance services to come out because they have vehicles, they have the hotline, they're trying to build, so they're converging all around their solutions for instead of coming up with new ones. So it's an area we haven't begun work on in a big way yet. We're still trying to figure out what are the entry points there. But it strikes us the police may not be the ones to enter from.
On that note, thank you all so much for coming today. Thank you to our speakers for
Obviously talk about this for hours. I really think that the different models and the different questions and the edges of the models and how do we connect to new models, it's a very rich discussion. I'm really glad you're able to.
I have a suggestion to make.
Yeah.
That we all meet here a year from today.
There we go.
To see
We'll
what
bring the
results
coffee.
are.
All right, thank you all so much. Yes,
I'm looking at it, it's kind of jealous.
Oh, nice to meet you.